means taking your temperature as soon as you wake up every morning. Down here you see the chart. You can do this on apps such as Natural Cycles and Glow, or you can do it with a pen and paper. And this is the first half of your cycle. It tends to stay fairly low. You get a big temperature drop and then temperature rise, and that shows that you've ovulated. In the second half of the cycle, we see that the temperatures are higher, and that shows that progesterone is there, which is what we want. You can also get changes in your cervical mucus, so often around ovulation you'll get changes in your vaginal secretions from being kind of sticky to more creamy, and then on ovulation, a day or two around ovulation, you'll get like a wet, slippery vaginal secretion. So this is often talked about being like egg whites. I really encourage people to, when they go to the toilet, go to urinate, just have a feel of your vaginal secretions each day and try and notice how they change. See if you're ovulating. After a day or two, they turn a bit stickier and then dry up, and that shows that you've ovulated. Some women will also have signs and symptoms around ovulation: tender breasts, pain, mood changes, but not everyone gets that. We can also assess ovulation on blood tests with hormone testing. All right, testing. Testing is really important. Like I said before, PCOS cannot be diagnosed on ultrasound, especially in younger women. So it's really important to assess insulin resistance, like I was talking about, as PCOS being a metabolic syndrome. We need to know what your blood sugars are doing. So this is looking at fasting glucose and fasting insulin. We also need to look at prolactin because, like I said before, PCOS is a diagnosis of exclusion, and hyperprolactinemia, which just means high prolactin, can be another cause of very similar symptoms to PCOS. So we need to rule that out and make sure what we're actually treating is PCOS. Sex hormone binding globulin is also really important. This tends to be lowered in insulin resistance. And we need to assess your androgen. So we can look at free testosterone or free androgen index, and we can look at total testosterone. What we really need to do is look at total testosterone and free testosterone with sex hormone binding globulin, because then we can get a picture of what's actually going on. Sometimes if sex hormone binding globulin is really low, such as in insulin resistance, which is common with women in PCOS, you can get a false reading with your total testosterone, looking like it's in normal range, but really it's not. So we need to look at that really closely. So they're my definite have to tests. Other tests you can do is luteinizing hormone, like I talked about before, so having a look if you get that spike during ovulation, and looking at that luteinizing hormone and follicle stimulating hormone ratio. You can look at progesterone and estradiol in the second half of your cycle. That can also tell us if you've ovulated. Transvaginal ultrasound, maybe. It's not necessary for diagnosis. If you're a young woman, say under 25, even under 30, it doesn't mean that much. So I don't know what's the point, but either way. There's other testing you can do depending what your drivers are, depending what your symptoms, how your symptoms are presenting, which can influence a little bit more the direction that treatment goes, but it's really on a case-by-case basis. Just a point here, there's no point doing any of these tests except maybe your fasting glucose and insulin if you're on the oral contraceptive pill. So oral contraceptive pill kind of shuts off all your hormones, so it's not going to give a true picture of what your body's actually doing.
Does that go for other types of contraceptives or just oral?
All forms of contraceptive, unless they're localized like the Mirena.
Yeah.
You still have to be a little bit careful about how you interpret it, but yeah, Implanon, mini pill, same thing. Okay, so like I said, diet and lifestyle interventions should be the first line of treatment all the time. It's not just naturopaths and nutritionists that say this, medical doctors say this as well now, and there's lots of evidence to support it. So let's go through some basic stuff. Like I said, I really want to get into the drivers and what might be perpetuating the symptoms of PCOS for you, but we'll go through some general stuff that can mostly apply to everyone. So a low glycemic index diet. Does everyone kind of know what low GI means? Kind of? No? Cool. Great. That means I get to draw on the whiteboard. So GI is about how quickly the sugar or carbohydrates from food get into your bloodstream. What we want is low GI, which means slower release of sugars into your bloodstream. So when we eat something low GI, our blood sugars go like this, gradually up, peter down. And that corresponds to our energy levels. So if we eat a really low GI, hearty, whole grain meal, we're going to get lasting energy through the day. If we have something high GI, we get an instant spike in blood sugar and then a drop. And that's when we get fatigue, we start feeling grumpy, we get hungry again, and that encourages that insulin resistance that I'm going to talk a little bit more about in a sec. So I like to think of this in terms of, say, the high GI would be having a really fluffy, white, processed dinner roll. That would just shoot your blood sugars right up, and then you're hungry again in half an hour, right? If you have a whole grain, rye, really seedy dinner roll, maybe with some avocado on it, some kind of fat to lower the GI, you're gonna get this gradual increase of energy and you're gonna stay full for longer. So that's really important with PCOS, is making sure that you have a low GI diet overall. I've got a little bit of information on GI here. If you want to have a look afterwards, you're welcome to. The other thing is having high antioxidant and anti-inflammatory diet. So basically just eating a rainbow. Each of these different colors has different antioxidant nutrients. So basically what we want you to do is be having all those colors every day. And that encourages a really good diversity of antioxidants and anti-inflammatory plant nutrients. Mostly plant-based, so not everyone has to be vegetarian, but meat every day is not a good idea. Having plant-based diet really encourages us to eat more vegetables, more whole grains, more legumes, which are all going to be more beneficial for our blood sugar. Appropriate calorie intake. So this is a really big one. It doesn't matter if you're trying to lose weight or you're not. You need to have an appropriate calorie intake for your energy expenditure. So it's like a scales where you have your energy output. Ooh, writing's terrible. So that might be just your general getting through the day, brain power, walking, moving around, thinking, everything. And energy input is all your food and drink. So you need to ensure that that's balanced. If you're putting too much energy in and you're not using it up, it's not going to be good for your body. The other thing is with PCOS and weight loss, there's been lots of research about high protein, high fat, low carb, high carb, all these different diets. The only thing that's consistent is in the research is ensuring that your calories are balanced. So if you want to be losing weight, you need to tip the scales so that your energy output is higher and your energy input is lower. So that's really important. Moderate fat and protein intake, not too much, not too little. And elimination of refined carbohydrates. So we don't want any of those processed white grains. We don't want any sugars or lollies. But having whole food carbohydrates at the same time is really important. So carbohydrates are necessary for ovulation. A lot of women who stop ovulating, it can actually be because you're restricting your calories or your carbohydrates too much. So you still need to make sure that you're getting some good whole grain, low GI carbohydrates in there. Yeah, cool. So lifestyle, I hate talking about weight loss. I really think everyone should just eat a healthy diet and be active. But the research consistently shows with PCOS that losing 5 to 10% loss of your body weight, if you're overweight, will help ovulation to return and your symptoms to reduce. What's more important to me is making sure your waist-hip ratio is less than 0.85. So this is basically putting a tape measure around your waist. So that's find your hips and the bottom of your ribs and that spot in between. It's usually around your belly button. Measure that and then measure your hips, which is your widest point, and then divide it to get the ratio. Yeah, consistently research shows that even if you're considered overweight or obese, your prospects are better in terms of long-term health, prevention of diabetes, prevention of cardiovascular disease, better fertility, if your waist-hip ratio is less than 0.85. So that means that even if you might be bigger, you still want to have that more of an hourglass figure rather than having all your fat around your center, which is around where all your vital organs are. So it's more about your body shape. The general recommendation is 150 minutes of exercise per week, with 90 minutes of that being moderate to high intensity. That can be quite challenging for people, and I really encourage people to work with someone, whether it be a PT, go to a